Fitzpatrick, take one, marker.
So what is Ikona? What's the product? How do you change the face of healthcare?
We want patients who are stressed and they're in an outpatient dialysis setting. This is the first time they're finding out that their kidneys don't work as the first use case. We want them to feel safe. We want them to feel like they're in an environment where they can learn. So when we put a VR headset on those patients and we work with clinical teams who are looking for ways to educate and engage their patients because they're low staffed and busy, we want to put a headset on, have a patient be able to spend 5 or 10 minutes understanding that this is what they can do, show them a story, make them feel like they can do this, build confidence, let them walk a mile in their future self's shoes. And that's what that 5 or 10 minute experience is all about. And by the end, we see lower anxiety levels, we see increased level of understanding, and then importantly, more and more patients who are ultimately deciding to pursue home options, which is better for the patient.
So it's storytelling and good clinical science all coming together?
It is, and it's kind of incredible. You don't often think about storytelling as being something that has a place in medicine as a way to help patients appreciate the complexity of their care. But it certainly is that. We've been surprised by a lot of our findings, and why is virtual reality, for example, more effective than a YouTube video, right? A really well done animation. It comes down to the neuroscience, and what's taken our team so long to understand is why is VR as a delivery mechanism for experiences? People have called it an empathy machine. I think that's for good reason. All of a sudden, patients who are stressed out are not able to take full advantage of their cognitive capacity. And when you put them in a safe environment, we see that level comes down. And now all of a sudden they're open to new experiences. Maybe they've been on that treatment for years, and suddenly they're open to trying something new. And these patients are in a tough circumstance. This is a life-saving, life-sustaining treatment that they're on. And the fact that we have the ability to bring storytelling into the mix to give them hope, is just a dream come true.
Do you have public information that you can share about the results that you've had or the number of patients that have gone through your VR therapy?
We do. So we've been lucky enough to get non-dilutive funding from the National Science Foundation to start conducting that early body of evidence. But we also just announced a partnership with Fresenius, who's the largest dialysis company in the space in the world and in the United States. Really exciting. Because of our success together in serving patients, we're lucky enough to have just received a grant as part of COVID CARES Act funding to expand access to care in rural Mississippi. So rural communities where COVID had a disproportionate impact, where patients don't typically have access to home therapies. That's an area where, because we've seen an average 41% reduction in anxiety, because we've seen increases of 51% in knowledge following a VR experience, we know that we're going to be able to increase the rate of patients choosing home meaningfully in an area of the country that's typically underserved and doesn't have the staffing, the tools, the resources to be able to give patients a second chance.
How did your team come together?
Well, myself, I'm CEO, and I was a patient. So I was in the military for 7 years. I spent my last 2 years in the service in the hospital, and 18 of those months was surgeries, wound care, isolation, and complete pain. So my understanding of the patient journey is clear, and thankfully I healed. I got out. I was able to get my health back. And when I moved to New York to get out of the service and start my new life, I met 2 physicians, and one of them had been a VR filmmaker, a virtual reality filmmaker, prior to med school. And what they had been working on while I was a patient is this proof of concept around using VR to help patients who are going through surgery understand a day in the life of surgery. And they were curious how that might impact anxiety, overall experience. So when we met and I saw the proof of concept that they had studied at Dartmouth, it all came together. First of all, it struck a chord with me, and I was covering emerging tech and technologies at a bank as my next job. and I knew it was something I had to work on. So we decided to launch the company in late 2016.
Tim, what branch were you in?
I was in the Navy, so not too far from here for a bit in San Diego, and over on the East Coast and stationed down in Florida, my last duty station.
What did you do?
I started out going through special warfare community. That was my first injury, hurt my shoulders. Then went through aviation, learned to fly, then hurt my back. That's when I needed all the additional surgeries. So did quite a bit, a lot of training. I spent a lot of time in training pipelines.
Oh, Tim, congratulations. Getting picked for buds and aviation, you're like a wunderkind. Thank you for your service.
I appreciate that. Thank you.
And I think it's fascinating how, like so many entrepreneurs inside of healthcare, you're here because your own story plays right into it. What difference do you think this kind of treatment would have had on you when you were a patient?
The chance to work on Ikona is a true privilege, it's an honor. Having my health is great. But the first thing I think about, and when I saw that VR module for the first time, was this would have set the stage for me to know what's next. Most patients, they ask that question when something bad happens, when something's not quite right, when they're given a menu of options or a stack of PDFs to say, hey, here's what to expect in your care journey. Their next question is, how am I supposed to understand this, and how am I going to get through this? So to give them a chance to say, I can do this, and here's what it might look like. And now I have demystified the scary part of what could happen next. And I feel like I have the knowledge, the confidence, and the skills to pursue this successfully. That's what matters to me at the end of the day.
Well, I know for myself, as I kind of get into like my fourth decade of my professional life, I look back on my time in the Navy, and it's like the teamwork that I want to see in healthcare is the same team that I saw in the fleet. I think it's very hilarious. People watch Top Gun Maverick. It's like, yeah, the guy in the plane, he's like tip of the spear. There's an army, well, there's a crew of people that are behind them that get them into that cockpit every single time. That's why I love the opening sequence of Top Gun. It's like you actually see how many people, there's a lot of asses on that deck to make sure that one aircraft gets off, gets fueled, the whole thing. So I hope you bring that to that's what we need in healthcare.
I can't appreciate you more for sharing that. I mean, I'd be lying if I said that first movie wasn't the reason I joined. My dream was to fly an F-14. They retired it the year before I got in. So yeah, I'm with you. That opening scene has defined a large portion of my life.
Yeah. Tim, thanks for coming by the studio.
Thank you for having me. It was a pleasure.
Tim Fitzpatrick, take one, marker.